Hello, my name is Olga Mimana, and today I'm going to talk to you about the electronic healthcare records. So, in short, the word EHR stands for electronic healthcare records. This is an electronic version of a medical patient history, as in it's a way that is used by the American healthcare system to store out the patient's history so that it can get easily accessed by different healthcare providers as well as the patient. So this was very helpful because it helped in the immunization, in the progress notes, immunization dates, and also vital signs. So was a very important process because it helped the EHR platform. It has different navigation tools. And some of them are the patient portals that are used by the patients when they are in the different situations, so where they want to easily access their health information. And also the check-ins and that they are to schedule the check-ins that they are having with their doctors. They can also be used to make the checks for the payments and other different information about the disease, which assists the physician in giving the information to the patient. So it's like a platform where the physicians upload the specific information about the patient's disease, so that the patient, when he or she needs to get further details about his or her own disease, can easily access it. In addition to that, they can also use it to access the payments or the charges about it, and also, as seen earlier, it's also portable. It's used mostly within the patient portals. So within this presentation, we'll discuss about the different healthcare EHR components, some of its benefits, and also some of the issues that are related to it. So let us start with the clinical care related components. So first of all, there is the computer CPOE, which stands for Computerized Provider Order Entry. So this is an EHR system that allows providers to enter orders in the computerized system, and orders including the drugs, laboratory tests, radiology, physician therapy, and many others. So that is that the EHR component, CPOE, does function in entering and entering the needs or orders by the patients. So some of its benefits are like it reduces the medical errors. This is because the computerized system avoids the medical errors by the pure penmanship. So this is penmanship of the doctors. So it's commonly known that the doctors are most likely have a poor handwriting, which results into many medical errors because of the patient might perhaps not be able to read it with ease, and thus ending up getting another perception about his or her disease. Another benefit of CPOE is like the information that is offered is in full package, which pharmacists and other healthcare providers easily access and can easily understand them well. So this is because it makes the ordering process more efficient, which also reduces the nursing and pharmacy staffs do not need to seek clarification or solicit missing information from the illegible or incompetent orders. So it's like because it's a computerized system, whenever they want to prescribe a given drug, they'll just click on it, as in they won't be writing it down, and thus the information will be very clear, as in they know the right dosage, because when they'll be prescribing it using the EHR, they will know, the patient will get the full information, because the doctor will not be thinking that the patient will not be rushing to write it up. He'll just be filling up the electronic health record, and that's the pharmacist getting the full information. So some of it, you can wonder, CPOE, does it have some drawbacks? So some of its drawbacks are like the limited skills of using this system. So this is because being able to enter the orders in the system requires different skills and qualifications. And those are like the typing skills, tech savvy, and also some physician might lack the different skills that are crucial into using this system. This might end up, this mostly results into many of the healthcare providers not being the ones to provide the healthcare services that are required. In addition to that, another drawback of this CPOA is like the patient privacy violation. This is because, as we mostly know that the information that is stored online, it's not likely to be safe, because there are hackers everywhere, and with this platform mostly, that many people are involved into the patient information exchange. So this limits the privacy that was always issued to the patient healthcare system or patient privacy system. Let us look to another feature, which is the clinical decision support tools. So it's in short, they call it CDS. So this is the provider's support tools that assist their decision making. The CDS system has different functions that helps the provider, and they include providing the latest information about a drug, cross-referencing a patient allergic to a medication, alerts to a drug interaction, and many other patient issues. So this is the component of EHR support that support the decision making of providers, whereby they tell every issue that can be raised in the patient when they are given a certain medication. It's like they give a clear detail about the perception or the body reactions that to expect from a given patient due to his or her body. For example, you can say that some are getting a drug adverse events because of their immunization system or their metabolism that is not coping with the given drug or the prescribed drug. So some of the benefits of CDS are like, first of all, it helps to reduce medical errors. This is because most of the time you see that the patients using the clinical, the patients are mostly described or prescribed the medication or medical drugs that are including some of the chemicals that they are allergic to. This complicates their case further, and thus making it a medical error that can lead to other complications that were not required. But then with the help of the CDS, they are aware of the patient's perception, and thus reducing the medical errors about the prescription of the medication. In addition to that, it also helps in reducing the patient's time of waiting. So for example, the EHR allows the patients to schedule meetings with the doctors, so which they allow also makes it possible for the doctors to receive a certain number. It came without knowing the doctor's position with the EHR. This is a problem that can be completely removed. So this means on the different hospitals there will be queues of patients that due to what they came without knowing that the doctors is available or not, or how is he coping with the work, or what the work overload is he having daily, they end up having many patients to address to within that day, and thus avoiding such a complication. The patients are able to know exactly what number of the patients are they receiving, and how and when can they reschedule their meeting with that doctor. So some of the drawbacks of the CDS are like first of all, there is the implementation cost. So this is because most of the people talk about the fact that the prices of implementing EHR are high, and they use it in their institutions. And the cost of implementing EHR include purchasing and installing hardware and software, converting papers into electronic ones, and also training the end users. So you find out that the implementation cost is very high because most of the people are very ignorant about how to use this system. In addition to that, another drawback is it's misleading the workflow. This is because normally the hospitals have their ways of operating the recording patient information and treating the patient. But the new system, there will be changes like end users being mostly involved in the treatment procedure. So this means that the patient will exactly be involved into how they should be treated, which will make the workflow that, or the decision making that was currently being used, make it delay, as in they'll go astray because they are not exactly following the line of work that they were used to using normally. So thirdly, there is the administration related components. So those are like the patient management. So the patient management component includes a lot of information regarding the patient and all services acquired from the healthcare institutions. So, and as part of the function of the patient management components, that it includes registering the patient admissions, transfer and records of demographics, insurance information, and also contact information and so forth. So some of its benefits are like the reduction of billing errors. So this is like normally the system, with the help of this system, the practitioner record the patient information, including the insurance terms. So they exactly know what amount to charge to that patient without going to further details. So there will be the billings that were given to the person, for example, neglecting the insurance rates that they are having, might get reduced. So they'll be able to easily track the patient's health information and thus be able to give him the right amount to pay. In addition to that, it allows to track the patient health progress. So this is because through the recording process, it is made possible to track the patient transfer. As in, even though they can, the provider is able to track and in a more secure way and easy way the patient health progress. As in, they know exactly, they are easily getting to know where are they moving from. They are moving from this, they receive this kind of care from the other provider. They are easily able to track out and know the patient health progress and avoid to re-administer to that patient the same medication or the same treatment that was given earlier. So some of the drawbacks of the patient management are like, first of all, it causes the delay in recording and using the system. So this is because due to the fact that workers were only using the traditional recording form of information on papers, it will be time costing for them to shift from the paper-based and thus adopting the electronic recording system. So it will be something very challenging for them because they have not been thinking up, they have not been used to using the electronic healthcare system. In addition to that, the reduction of productivity. So first of all, some of the work line providing the information to patients are no longer done in person, as though the system providers display the information on the system. So the provider's productivity will be reducing because the system, from end users learning the new system, and they may potentially lead to some losses and revenues. So you can see that there will be reduction into productivity because the system did not enable the people to work on themselves or on their own. As in, they'll be letting these electronic devices be the one to handle the work, and thus reducing some of the productivity that people were able to perform by themselves. Like, for example, providing information, as in they'll be limited, they'll be sharing little information because of the electronic health record, and thus the the provider having a little information and thus giving the treatment that will result not being that efficient. Lastly, there is the meeting scheduling. So this is through EHR, the patient and doctors are able to set up a meeting. So this is without any of them moving. As I said earlier, this EHR gives them a platform to specifically schedule a meeting with a given provider. And this enables them to avoid wasting their time. First of all, some of its benefits are like abolishing the hospital long lines, as in they are able to schedule the meetings on a given time because they are seeing that the doctor is available, or where the doctor highlighted that he or she is available. In addition to that, it helps into improving the healthcare quality. This is because through it will avoid the congestion of people within one, or the overcrowding of the patients within the hospital, and thus giving a much bigger space for the other patients to get the treatment, and thus giving a better quality of care, and thus and also minimizing the number of people that the doctor has to attend to in a day, as in they'll be limited to a given number and thus not exceeding, which by reducing the number of the patients to address to within a day, they'll be able to administer the right treatment, and thus resulting into the better quality of care, healthcare services. So some of its drawbacks are like the reduction of the face-to-face meetings. So it will be something bad, because within the face-to-face meetings, the doctor would have been able to assess the healthcare provider to assess easily the behavior or the wellness of that patient. But then with the reduction of their meeting, they'll thus end up not having enough time to criticize them or ask them enough questions to exactly tackle the right disease they are having, or any other symptoms that they are showing. In addition to that, it limits the number of clients or patients. So this is because more patients will get reduced, as they will be limited to a given number within that hospital. In short, the importance of the integration of the administrative clinical areas for effective use of an EHR are like the integration of the administrative and clinical areas would allow an easy and secured way of recording and storing patient information. So this is because having the integrated system of the administrative and clinical areas means that the administrative team and the clinical team work together as a way to make different traces. As in, the administration will exactly know how to reduce, as in they will be knowing where are they having a gap, and also linking it to the clinical areas. And also the integration of the administrative and clinical areas would allow the provision of quality care at low cost. This is because the main purpose of the EHR is to be able to provide quality care at a low cost, so as to make most of the people access to it. So if they link the administration and the clinical areas, they will be able to merge them, and thus being able to reduce the costs, because the costs that were involved into the healthcare provision will be reduced. As in, for example, the people that were in charge of recording that data will no longer be available, and thus not the hospitals not having much money to pay, which will thus result into a low cost of the healthcare services. So thank you very much for your kind attention. See you next time.